Dr. John Wilhelm, who is my chiropractor in Bozeman and also happens to be an official team chiropractor for the USA bobsled team. So he kind of knows what he's talking about. He's going to show us some things today. You're welcome. About staying aligned when we're on the road. So let's get to it.
Yeah.
So what is this?
Okay, Jackie, this is called VooDoo Floss. It basically is a thick type of TheraBand, all right, that we're going to wrap around a joint and compress the tissues of that joint. That then when you take it off, it helps to shear the tissues together, break up adhesions, get better blood flow, restore motion, feel better.
Okay.
Okay,
Awesome.
perfect. So we're going to demonstrate on you, okay?
Okay.
So I just want you to, so say you had an aching elbow, okay? Yeah. Couldn't extend range of motion, but this could be a shoulder, could be a knee, could be your ankle.
Okay.
All right? What you're going to do with the VooDoo Floss is you're going to extend, take the VooDoo Floss, anchor it down with one wrap, okay? And then you're going to start wrapping at about 50% tension. Now, while we're doing this, you shouldn't feel like you're totally restricting all the blood flow. Your hand shouldn't turn purple, shouldn't fall off, okay? Shouldn't feel tingly, all right? But you should feel like it's compressing your joint. Pretty good.
Okay.
And notice again, I'm covering about half of this and using about 50% of the tension. You're going to wrap slightly below the painful joint, slightly above the painful joint.
Okay.
When we get to the end, we simply tuck it in underneath itself, and then we're simply going to move the joint. At first, we're going to move it passively. So I'm just going to have you swing your arm back and forth. Okay? That'll hold the tissues above and below. Okay? And you're going to do that for about 15 seconds.
Okay.
And then you're going to swing it side to side in front of you. Again, you're passively moving this joint. And then we're going to get into active range of motion. So what I'm going to do is I'm going to flex this. And you can feel some tension and then extend it. Flex it and extend it. And obviously you'll be doing this on your own, so you're going to bring it in slightly more range of motion each time. So while you're doing this, the muscles and the covering of the muscles, the fascia, are gliding. It's finding adhesions, and as those glide, it's breaking those up, bringing localized blood flow into the area.
It's like a massage.
You got it. It's like a deep myofascial release.
Okay.
You don't need the massage therapist. You brought it with you.
Right.
Okay? Perfect, right? And so this can be done on a knee, same kind of thing, or a hip.
Good.
Yeah, you got it. So you could swing back and forth. First passive, getting some passive motion. And then, for instance, if your knee was sore from a big hike or something like that, you're just going to do some squats.
Okay.
Changing that range of motion. Any stretch that you would normally do, you can do with the VooDoo Floss.
Right, okay.
Okay?
So with the shoulder, would you rotate or?
You got it. You would go through the ranges of motion.
Like fly motions?
Yeah.
Okay.
Front and back. Side to side in the same plane as your shoulder blade. You would bring it inside and outside like this. You bet.
Okay.
Okay.
Cool.
And then simply unlock, unwind. And the great thing about this, for a traveler especially, is VooDoo Floss can then be rolled up. Yeah, you feel the blood flow?
Yeah.
You bet. So immediately you should have some relief and improved range of motion. You shouldn't be too sore from this or anything.
Okay.
And like I said, the best thing I think about this is you can roll this up. It weighs about 5 ounces. Okay. Can be put right into your bag. It could slide in the end of your shoe for travel.
Oh, there you go. That's a good idea. Wow, okay. Yeah, that's really light. It's really light. It looks like it might be heavy, but it's actually not. It's not that bad.
You bet.
Okay.
Yeah,
cool.
so compact,
VooDoo Floss.
light, VooDoo Floss works on a number of different joints. I wouldn't wrap it around your neck or head. Just a disclaimer, because I'm a physician, all right? Got to make sure we throw those things in there. But for elbows, wrists, ankles, knees, you can do some things in the hips with them. You can wrap it around a tight hamstring, or if you pull a hamstring or a groin or a quad, those can be horrible when you're out traveling and having to carry a backpack and hike and move. This works wonderfully for that.
Okay, and where can we get this?
This particular band is from Rogue Fitness, so rogue.com.
Yeah.
Okay, they provide a lot of things for CrossFits and those type of athletes, but you can just Google VooDoo Floss. There's lots of different brands.
Awesome. Great.
Yeah.
There you go.
All right, so what we have here is called a mobility ball, okay? Also called a myofascial release ball. And these are used to compress tissues, to allow for movement underneath the compression. And then when we take the pressure off, it restores normal mobility to you, okay? So this could be a tennis ball, this could be a lacrosse ball. These type of devices last a little longer, the ones that are specially made, but you don't have to buy a special device. So what we're going to work on is that feeling you get after you've been on a long plane ride, after you backpacked for a while, and you get that tension in your neck and upper back that sends this sharp pain to the base of your skull and ends up in a headache that's behind your eyes and it's just miserable. So we're going to release with this. Okay, so I'm going to have you hold on to this with your left hand. And what we're going to do is we're going to find this very important point. Now this is the key to doing this properly, is knowing where this is. There's three main muscles that cross here. One that lifts your shoulder blade, one that rounds you forward, okay, and one that holds you back. The problem is they don't get equal tension on them after we've been sitting for a long time like this and on our devices and on the plane. So if we come down the neck, about where your t-shirt's going to hit, and just in front of your trapezius muscle here, you're going to find that point. So I want you to put the ball on that. You got it. Come forward.
I can feel
it right away?
Yeah.
Good. And then we're going to wing this out just a little bit. Okay? So you're pushing into it like this.
Okay.
Your other hand goes on top of your head. You're going to find out what that's for in just a second. So what we're going to do is we're going to work on this while you're breathing. So as you breathe in, you're going to put firm pressure into that. And it's going to hurt just a little bit. And then as you breathe out, you're going to move that back and forth. Small circles. So this is breaking up little adhesions, getting blood flow into the area, freeing up the tension that's bound up in that thing for hours, days, weeks, months. So you're going to do this for about 8 breaths, getting this nice and mobile. Once you've done that, we're going to add a little bit of a stretch to it. That's what the other hand is for. Okay? So now, as you breathe in, you're going to compress, but then you're going to pull. And then breathe out and rotate. This is called pin and stretch. So basically you're pinning into the muscle, stretching it, and then as you're relaxing, you're mobilizing. So you're gliding those tissues underneath, bringing blood flow, oxygen, and relief. And you'll notice that just a little bit of a change in angle of your pull will change how it feels. So this time, tuck a little, hold just a little bit back. Instead of coming straight to the side, tuck down and forward. So push and forward. You feel the difference there?
Yeah.
Okay. Because remember, you have several muscles converging right here. You're just trying to hit the point that's going to help unwind them all.
And can I use a hand? Can I use my fist?
You bet. Absolutely. So what we're going to do, exactly, is just make a fist, okay? Whichever feels most comfortable to you, take either your knuckle or the edge of your thumb into that same point. Okay?
It's sharper.
You got it, absolutely.
Yeah.
So you can use whatever feels most comfortable and fits the best to you, but we fit our own anatomy pretty well, and you're going to do the same thing. Now, if you happen to have a travel buddy, they're really useful for this as well, because they can come and they can help you with their hand or knuckle, let them know where the right point is, okay? Pin and stretch.
Oh man.
You got it, and then release. And you're going to find that the areas you've worked on are going to have immediate improved range of motion, whereas the other areas are going to have some tension. And if you do this both sides, you're going to notice very quickly that headache goes away, you feel better, move better.
Amazing.
Okay, and we're going to show how this works in some other areas that you can use on yourself.
Cool.
All right, perfect. Now we're going to show you some more points where this is effective, okay? All right, perfect. So have a seat. Okay, so if we follow the line along your shoulder blade, okay, you feel the inside of your shoulder blade, and then you can feel this ridge on the top of your shoulder blade, okay? If you follow those points and come out slightly, there'll be a really tender point right in there. Okay. You feel it?
Yeah, I feel it.
Okay, you got it. That one's super important if you have any pain radiating down your arm, if you feel tight and restricted between here, and is also related to the one we just talked about that then goes up the neck. Okay? It's probably the second most important point. Okay? So if we were going to mark that little point on there as an important one to remember, Follow the ridge of the shoulder blade. Right up here, you'll feel that bony prominence. Come to the inside of the shoulder blade, and then just off into the muscles inside there. Okay? This point can also be released with this. To do that, I'm just going to have you lie back. Okay? You're going to take this, slide it back behind there, try to hit that same point.
Oh, I can feel it already.
You feel it right away. And you'll know when you got the right spot. Almost everybody, nearly 100% of people, are pretty tender right there. Okay, so 2 things that you want to do. Number 1, just what you're doing. Lay right on it with compression. Okay? You're going to want to do that for about as long as you can stand it. Okay? Or 30 seconds, whichever comes first. Okay?
Okay.
It's a very tender point. Okay? Right now, you're squeezing the tissue together. There's areas of inflammation and toxins that are built up in there. As you squeeze it, it's called ischemic compression. It pushes some of that stuff out. So then, when you sit up and come off of it, immediately blood flow is being released into this area. Okay? This is a great one to do where you just lay right on these points right before you go to bed. It's going to help you sleep better. It's going to help you move better in the morning.
Amazing.
If you feel tight and you want to release this before you go out and do something, okay? Or for instance, if your low back feels tight, but you have a big hike coming, I'll show you how to do that next, okay? So we're going to find another point here, okay? This one is really important if you have any pain in the hip or any pain that radiates down the leg or a general feeling of tightness across your low back, okay? What you're going to do is I just want you to put your hand on top of your own hips for me, okay? So there you're at the top of what we call the iliac crest, okay? If you come down off of that, you'll have the divots, kind of where you can see when someone has a bathing suit on. If you come directly over from that and down, there's going to be a point right in here, okay? That's called your gluteus medius. And if you bring this around, you should be able to find it, okay? So what I want you to do is lay back but slightly to your side. Good. Bring your hips over this way a little.
Oh, I feel it.
There you go.
Oh,
So,
I feel it.
again, you got it. You will know it when you find it. So this is another one of our very key myofascial points.
Wow.
We call this a center of coordination. Again, a number of muscles and fascial lines are coming together right there. So you're putting pressure into it, which is perfect before you go to bed.
Wow.
Okay? It releases a different type of joint sensor. But if you were going to be going out on a hike in a half an hour and you wanted to feel more loose, what we'd have you do is rock back and forth on that. Slowly at first, and then as you do it, from 1 to 4 minutes. Don't get on these spots, please, for more than about 4 minutes at a time. Okay? Because they're so focused, you can cause yourself more pain and more inflammation. Probably not major injury, but it won't be as effective as if you just use focused treatment for a shorter period of time. The more you do this, the more you'll be able to tolerate, the better it'll feel, and the quicker it will release.
Awesome.
Okay? So, as a review, for these 2 points, the gluteus medius, come off the top of the hip, find the divot, okay, the little dimple, come over, and then you'll quickly find that. For the one up here, we're going to come off the very top of the shoulder blade where there's a ridge, come to the middle part of the shoulder blade, off that into the soft tissues. You'll know it when you hit those points like Jackie did. And again, if you're trying to relax these tissues after a long day just to get loosened up, sustained pressure for 30 seconds to a minute or whatever you can stand. If you're getting ready to go out and do something adventurous or athletic, spend 1 to 3 minutes mobilizing these areas slowly at first, more vigorously as you go.
Great.
Okay, that's
Thanks.
it. Yeah.